Well, let's talk with someone who knows these issues well. I'm joined from New York by Dr. Lloyd Sederer. He's the medical editor for mental health at the website The Huffington Post. He's also an adjunct professor at the Columbia University Mailman School of Public Health. Lloyd, let me start with that report that we just heard from Jim. Does it surprise you?
It's a terrific report because what it is, in a way, is a call for responsible journalism. The power of the press is extraordinary, and if the press is magnifying, exaggerating, putting the accent on the negative, it's going to affect how people think about people with mental illness and about violence.
So the key here is context. So I guess getting right to the heart of this, when we talk about the facts of mental illness, is a person dealing with a mental illness typically violent?
There are at least four prototypes of violent people. There are psychopaths. These are criminals. These are people who don't care about anybody else. There are people who are enraged and aggrieved. They want to settle a score. Then there are also people with acute psychotic illness, severe mental illness. They're hallucinating, they're paranoid, they're afraid. Their risk is greater when they are acutely ill. And then the fourth prototype are those people who are actively using alcohol and drugs. And the reason for that is because those substances disinhibit us. They turn the brakes off in the brain. These are not mutually exclusive. You add one onto the other, the risk keeps going up. But what it says is that there's not just one prototype of of violence, and portraying that to be people who are mentally ill is just wrong.
And so talk to us about this stereotyping of a mentally ill person, not just on the person himself or herself, but more broadly on society. How does it impact it?
Well, it affects the mental health, self-esteem of the individual, their family. They are apt to have a harder time getting a job, socializing. There are a lot of negative effects that result from how our attitudes, our cultural attitudes, our social attitudes towards a variety of people. The same is true of racism, for example. These are pejorative ways of looking and treating other people, and they have very negative effect.
Can we talk a little bit about infrastructure in place to treat mental illness? The World Health Organization says that worldwide, fewer than 4% of doctors, nurses, and midwives are trained in mental health. Europe has the fewest. The Americas have the most. That appears to be a problem, don't you think?
There still is a gap between the need, which is very extensive in terms of the number of people with mental illness, with addictions, and those people who actually go for care, and the capacity of the system to support them. The mental health addiction services have forever been discriminated against, underfunded when compared to other general medical conditions. So people who are ill, and treatment works. Treatment works for psychosis. It works for addiction. This is the way to improve the public's safety, is by treatment, but we don't have enough resources devoted to treatment, and that's starting to change. You see that now in one response to all of the media coverage. It has helped support greater resources for people with addictions first, and with mental illness as well.
Lloyd, thanks so much for joining us.
If you like what you just saw, follow us on social media and visit our website, cctv-america.com.